My name's Dr. Jonathan Gubbay. I'm a medical microbiologist at Public Health Ontario Laboratories. So at the Public Health Ontario Laboratories, I work predominantly in areas of virology with a little bit of bacteriology as well. So in virology, I help oversee respiratory and gastrointestinal viruses, also some testing for herpes viruses, and arboviruses, which are mosquito-borne viruses. I also help with setting up laboratory response with emerging viral pathogens. For example, the recently emerged Ebola virus outbreak resulted in our laboratory setting up testing for that. And when we've had other emerging viruses, I've led the response at the laboratory for those. PHO Laboratories is in a unique position in that, on one hand, we do a lot of primary testing for services that some healthcare institutions may not have, such as for virology. We do a lot of basic virology testing. And then we also do a lot of reference testing in many areas. So, for example, we have reference bacteriology. We do molecular investigations when specimens are not able to find the pathogen. We look further into it. We do molecular typing for viruses, which isn't really done anywhere else in the province. And so it's a nice combination of pushing through a large volume of samples, and through that we see interesting things, and also receiving referral samples where people are needing to find more information about what's going on. We're looking closely at several different viruses. We've just published a paper looking at a new genotype of a virus called respiratory syncytial virus, which is the most common cause of respiratory infection in children under 1. And when we looked at some samples from back in 2010, we found that we had a new genotype, and we named it ON1, and that's resulted in over 50 publications from across the globe looking for the same virus and studying it further. So that's been very interesting. I'm also focusing on looking at the significance of looking at the quantity of a respiratory virus in a sample and see how that correlates with severity of illness and outcomes. So what I really like about working at PHO is that I'm working with a great group of people, and that is not just within our laboratory, it's across the whole organisation. And that means that when we're involved in projects that sometimes have rapid turnaround, there really is a good team spirit, and it makes my job a lot easier to deliver on what I need to when I know that the people around me are also pulling their weight and helping as much as I'm trying to myself. As a team, we're really doing what we can to further the health of Ontarians.